Hello, my name is Mary Albert, and I'm an implementation specialist with Brown & Brown. We are the broker on behalf of your group. And what that means for you is you have an account management team that is dedicated to you pre-enrollment, post-enrollment. If you do have any questions throughout this upcoming coverage period, you have an account management team that is dedicated to you. Now, your enrollment window will begin November 13th and run through December 8th. This is an active enrollment, and what that means is you will actively go on to ADP to enroll or decline in the benefits that are being offered to you. Your coverage period will begin January 1st, 2024, and run throughout the duration of next year. My goal today is to provide an overview of the benefits that are being offered so that you do feel confident in making those elections for this upcoming coverage period. Now, there are some things that are changing. You will see some of those highlighted here on this page. This is going to be for you to refer back to. I will address these changes as I present each benefit. Now, if you look here, there are some things that are listed that will deem you as an eligible employee. If you are adding dependents onto your plan, you will be asked to provide documentation that would verify them as your dependent. Now, I did mention your open enrollment does close December 8th. Once that December 8th rolls around, you will be sealed or locked in throughout this upcoming coverage period. However, if you do experience a qualifying life event, such as some of those listed at the bottom of the page, marriage, divorce, birth, or adoption of a child, please reach out to your HR team within 31 days of that event to see if coverage can be changed. Now we are going to take a look at the medical options that are being offered to you. You're being offered 3 plans, and these are all following under the carrier of Blue Cross Blue Shield. Blue Cross Blue Shield is your carrier. However, when you call the doctor or a facility to make an appointment, I would advise not asking them if they take Blue Cross Blue Shield, because quite often they will, but they might be out of your network. One of the most important things on this page, and I am going to go ahead and highlight this for you so you can see it, is the name of your network. On any of these 3 plans, the name of your network is Blue Options. So when you do make that appointment, I would advise that you ask them if they are in the Blue Options network. By staying in network, you are able to lower your out-of-pocket expenses and maximize these benefits that are being offered to you. Now, when you're looking at this page, I would say, frame the question, what do your current benefits look like? What's working, perhaps what's not working? Do you have any procedures or treatments scheduled for this upcoming coverage period? By thinking of that question, it'll guide you into making the best plan choice for you or you and your family. Now, the great thing is, on each one of these plans, if you make your adult and child wellness exams, which could include your annual physical, that includes your annual blood work, any preventative screening that is appropriate for your age and gender will be covered at 100% when staying in network. Now, when you make that appointment, I would advise you to use that terminology so it is coded correctly. Lots of things on this page. I'm going to break it down to 2 ways that you would pay for these services. We're going to talk about what deductible plus coinsurance means, or what a copayment means. So we're going to use this first plan as an example. Now, one of the changes that you will see in this upcoming coverage period is a name change. This plan, I'm going to go ahead and zoom in for you, is referred to as the base plan. HDHP simply means it's a high deductible plan. This was referred to as an HSA plan in the past. You still have it as an HSA. It's just going to have a name change. This middle plan, the center plan, is now called the mid plan, and it was referred to as a copay plan last year in this current year. Now, this plan to the right was your HRA plan is now referred to as the high plan. The HRA is a health reimbursement arrangement, to which meant that you had some behind the scenes reimbursements for claims that were filed over a certain amount. That portion of it will be going away for this upcoming coverage period. However, the plan will still be in place. So we're going to use this first plan, this base plan, as an example. You'll see a lot of services that say deductible plus coinsurance. So for example, if you go to an office visit, you would be expected to pay deductible, and we'll talk about the coinsurance in a moment. When you stay in network and you see a service that has the word deductible beside it, of course, you'll see there are some examples of that type of billing, I should say, on this center, on this middle plan. If you go to the emergency room, of course, there are some services on that third plan. When you go in network and you are expected to pay towards your deductible, you would be paying a negotiated, reduced, contracted rate for that service when staying in network, because that provider has a contract with Blue Cross Blue Shield. So each time you would seek out a service that has that deductible beside it, that money that you're paying towards that negotiated, reduced, contracted rate gets accounted for and goes into a bucket. The bucket of money that would be added into is called your deductible bucket. So let's go ahead and take a look at what the deductibles are on these plans. So on this first plan, this base plan, this top number is if you're signing up employee only, and the bottom number is if you're adding dependents. So if you are making payments towards your deductible, it goes into, let's use employee only as an example, a bucket that can hold $2,500. Now, you may never meet your deductible throughout your health journey, and that is okay. If you were to hit or meet your deductible, that means you're out of pocket $2,500 for the services that are tracking towards your deductible. Over here on this higher plan, it would be if you are out of pocket $1,500 towards your deductible. If you meet your deductible, you've knocked that wall down, you then go on to phase two. Phase two is called coinsurance. Coinsurance is a cost sharing between you and the insurance company. So if you were to then seek out services that say deductible and you've met your deductible, you now are going to pay 20% of those health covered service bills when staying in network. If you, in contrast, look over here to your third plan, that high plan, if you were to meet, of course, you might meet that deductible sooner because it's a lower amount. Once you were to hit or meet that $1,500, again, employee only, you then, if you receive a health covered service bill, would be responsible for 10% of the bill. Blue Cross Blue Shield would be paying 90% of that bill. Now, the third phase is your worst case scenario. Heaven forbid, if you are out of pocket to the third phase, this is considered your out of pocket maximum. On these first two plans, if you were to be out of pocket for those health covered service bills at $5,800, you've met your out of pocket. Health covered service bills thereafter, when staying in network, would be covered at 100%. Now, if you note over here on this high plan, that out-of-pocket maximum is lower. So potentially you could hit that sooner. Now, if you don't see deductible plus coinsurance, you would see something that is referred to as a copay. So when you see just these dollar amounts here, sort of pointing at them, just to highlight those are considered to be copayments. A copayment is a fixed flat dollar amount that you are expected to pay at the time of service. Some people like copayments because they know what they're going to pay when they go for those services. I'd like to say, imagine it's like a ticket to go back to see the doctor. Now, if you were to seek out a service that has a copayment attached to it, that as well is accounted for into that out-of-pocket maximum bucket. So it's good to know that all your money when staying in network is tracked that way. And you would know that if you hit that amount, there is a limit to what you would be expected to pay for those health covered service bills. Now, each one of these plans is considered a PPO, which means you can go in and out of network. However, I'd like to explain what it looks like if you do go out of network. I'm going to go ahead and zoom in here so you can see these numbers down here. We'll use this, let's go ahead and use this middle plan as an example. If you note, you can see what these buckets of money look like. The moment you step out of that blue options network to that doctor that is taking that insurance but might not be in that blue options network, those buckets of money, anything you've paid and have been tracking towards in network starts over at 0. It is going to be quite difficult to try to fill both of those buckets of money. It would be much more expensive to get to that out of pocket if you were seeking out a lot of services. In addition, those out of network doctors do not offer that negotiated contracted rate. So oftentimes they would charge you more and you would be responsible for that balance. I always tell members, if it is in your medical best interest to seek out an out of network doctor, you do have that choice, but I do like to empower you with the knowledge of knowing that would cost more. Now, the great news is that Blue Options is a very large national network. So a lot of providers are participating. The best way to know if a provider is participating is call, ask them if they're in network. And of course, I encourage everyone to create a member portal with Blue Cross Blue Shield. And that information and how to find those in-network providers would be listed there as well. Now, you do have medical prescription drug coverage, I should say, on each one of these plans. The way it works is if you are on that monthly medication, you would go to your member portal page. There is a pharmacy tab to which if you type in the name of that medication, it places your medication into a tier. Depending on what tier your medication falls in would determine which one of these co-payments you would be responsible for paying when you do pick up that prescription. Now, if it's in your best interest, talk to your doctor. Oftentimes, if you do receive a generic prescription, that does drive the cost down, as well as something that's written in a 90-day supply. Now, I do want to note that if you are on this first plan, you would have to meet your calendar year deductible, which we talked about that up at the top, before you are responsible for that copay. Now, I do want to make reference to this plan. We refer to it as that base plan. This is your HSA plan as well, which means if you sign up for this plan, you would be able to open up a health savings account, to which that is what I'm going to get into next. I do want to note, though, there are benefits to all three of these plans. They're all solid plans. I don't work for Blue Cross Blue Shield. This first plan would be the lowest out of your paycheck. However, you might be responsible for paying a little bit more if you go to, for example, an office visit. In comparison, this plan to the right would be a little bit more out of your paycheck. However, you might pay less when you go to the doctors. So they're all three solid plans. It just might look a little different throughout your health journey and how you pay for those services. So like I noted, this is your HSA plan. Prior to getting to that, I always like to share this table with Ed Morse employees. I think it's safe to say you do work for a great employer, and I'm sure you all know that by now. This chart illustrates even more so how they invest in you, and they do absorb quite a bit of these medical costs. For example, if you were to sign up employee only and you've elected that first plan, that base plan, Ed Morse is absorbing 80% of those costs for you. So it's just good to share that great news with you. Now, I mentioned that first plan is that base plan. If you sign up for that plan, you don't have to put any money into a health savings account. However, if you do want to take advantage of a health savings account, you must elect that first plan. So what is an HSA? Let's say you make $30,000 a year, and over the course of the year, you want to contribute or put $1,000 of your earnings into this savings account. Now, your taxable income has dropped to $29,000. That's your first benefit. You have this money, you've tucked it aside, it has not been taxed. That is a huge savings. So you might think, this is my money, I want to be able to use it. You can use it. You can use your HSA money for eligible medical, dental, vision expenses. You can use it on yourself or your spouse and children, even if they are on a different medical plan. So what's an eligible medical, dental, or vision expense? We do list it in the upcoming slides, but it can range anywhere from when you do go to the doctors, any of those services that say deductible plus coinsurance. You can use it for glasses. You can use it when you go to the dentist, Band-Aids, sunscreen, if it's a certain SPF. There is a wide range of what is considered an eligible medical, dental, or vision expense. In addition, your accounts would be set up with Bank of America. Bank of America does have an app. I would encourage you to download it because on that app is a scanner. You could walk into Walgreens, scan an item, and it'll tell you if it's an eligible HSA expense. So this money has not been taxed. You have access to your money. The great thing about an HSA is it's not a use it or lose it situation. And that means that throughout the course of the year, you have access to it. If you are not using it that much and you have money left over, guess what? It rolls over year to year. This money is always yours. It's always there if you're not using it. And if it reaches a certain value, it can even earn interest. And if you did decide to leave Ed Morse, this money is yours. It would go with you. Now, there are some contribution limits that we've listed here. And if you do sign up for this plan right here, look at this long list. This just illustrates some of what is considered to be those eligible expenses. I always like to note this here. IRS Publication 502 would give you that full comprehensive list. Now, if you do want to have money that you're contributing into your HSA, you would seek out a form like this from any of your HR leaders. You'd complete it. Of course, you can just say what you want per year, break it down per paycheck. Ultimately, it would be the same. And make sure that you turn this into whoever oversees your payroll. It would be going to Karen Sims, who is the director of your payroll, but it's going to be important to have this paperwork turned in during that open enrollment period that we talked about, or I talked about at the beginning. Now, there are many ways to save money on your medical plans, even if you're choosing to do some of the things I'm going to share with you that would not be tracking towards those plans. I mentioned on that first plan, that base plan, that HSA plan, that you would have to meet your deductible before you're responsible for a copay on that prescription medication. However, GoodRx and Single Care are some great examples of ways that could potentially save you money if you do receive that one-off prescription. Years ago, both of my daughters were on my medical plans in college. My youngest received a one-off prescription. And with our medical plan, our insurance, it was going to be over $80 for me to have that prescription filled. I went to pick up the prescription at Walgreens, and the tech recommended that I look at GoodRx. It drove that cost down to $13. So that is how I filled that prescription. GoodRx and Single Care are free websites. You just type in the name of the medication, and not only will it show you the different pharmacies that medication is available at, it will also tell you the cost associated with picking it up. Now, oftentimes it can save you money. We share this because it can save you money, but also be aware that if you do take advantage of these websites, or these savings, I should say, that does not track towards your out-of-pocket maximum or towards that deductible. However, it might save you money. I also like to share with members this right here, where you have your prescription filled is your skin in the game. Um, Certain pharmacies offer flat discounted programs for certain medications. For example, for years here in Publix, if you had a prescription for an antibiotic, you could go to Publix and get that prescription for a generic antibiotic filled for $0. So it's your skin in the game. Where you have that prescription filled is an opportunity to save money. If you do use your medical insurance, make sure that you are seeking out those in-network pharmacies. Also, as you're listening to this, one thing to note is, where would you go if you are not feeling well? It is good to create a roadmap now. Always know your in-network doctors, of course, your in-network urgent cares in clinics. It's good to know this in advance, because if you're not feeling well, that might not be the time to figure out which one of those urgent cares you can go to. Now, of course, there is a higher cost associated with that. If you were to need to go to the hospital, it's important to know that as well, which hospital is considered in network. Years ago, my daughter dislocated her knee. I was in the ambulance. They weren't sure which hospital to go to, and I didn't know either. So create a roadmap now so that you are knowledgeable of where those in-network facilities are. We do like to give you more ways to save money. Some of these that are listed below, Sanitas Medical Center, could be in your area. These facilities have a better negotiated contracted rate with Blue Cross Blue Shield, and can even have lower cost associated with those services. In addition, value choice providers also have better negotiated rates with Blue Cross Blue Shield. So how do you find those value choice providers? Those can be found when you are searching for a provider through your member portal. It would be designated as such. It doesn't mean they're less worthy of a doctor. It means they have that better negotiated rate. So there are lots of ways to save money. Another great benefit that you do have an option for when signing up for medical is Teladoc. Teladoc is virtual care, and I've heard a lot of folks, especially from Ed Morris, that have shared with me they've taken advantage of this, and it's been great. The way it works is you would get in contact with a licensed health professional in as little as 10 to 15 minutes. If they deem it medically necessary, they can even write you a prescription for your needs if you do need that. Now, if you are on that first plan, that base plan, this would track towards your deductible, and you would be offered that reduced negotiated in-network rate. If you sign up for this, the mid plan or the high plan, and you're seeking out the care of a primary care physician, it's not going to cost you anything. So this is a great way to save money. Now, of course, if it's more of a specialist need, there might be a copay attached to that. However, that will track towards your out-of-pocket maximum. So if it's the middle of the night, if you're traveling, if you just don't want to go to the doctor, take advantage of Teladoc. I'm going to give you a little homework assignment. Download the app, know the website, and know the phone number. Know these things now. Again, if you're not feeling well, that is not the time to fumble through things and get this set up. Now, you are being offered dental plans, and this is going to be offered to you through MetLife. Again, know the name of your network when you're making those appointments to ensure if you are staying in network, you are going to maximize these plans. There are two plans, a low and a high, being offered to you. When you're seeking out that preventative procedure, such as your teeth cleanings, your exams, certain x-rays, you will not pay anything for those services. Now, if you were to need basic procedures or major procedures, you would pay a one-time dental deductible, and then the plan would cover you at a certain percentage. So, for example, if you were to need a filling, after you've hit that deductible, let's say you've elected this high plan, the plan covers 80% of that bill, and you would pay 20%. Now, it's good to know that on this low plan, which I smile because is a lot of people's high plan, you have $1,500 of an allowable benefit that can be used to cover claims or to pay claims throughout the course of your year. Now, this $1,500 is per person on that plan per calendar year. It always replenishes come January 1st. This is one of your changes for this upcoming year. Your high plan is $5,000. That means that you have $5,000 of an allowable benefit that could pay out these claims throughout the upcoming year. And that as well is per person per calendar year. That is a change that you will see on your dental plan. Now, your child orthodontics, the new change, another change I should say, is if you do elect this high plan, it now covers adults as well.